At a recent press conference of the Federal Department of Health and Human Services, a group of long-signaled rule changes was announced that would withhold federal funds from any healthcare organization offering gender-affirming care. However, what most caught my eye and disturbed my ear was how both the people on stage and the proposed rules themselves echo the deceptive language that Tennessee has used in its own laws, specifically SB1 HB1, passed in 2023 and banning care for trans youth. At its most basic, both the state and the Fed play at some crude linguistic switcheroo, replacing the descriptor gender-affirming care, for example, with the petty and inaccurate term sex-rejecting procedures. Then there are the red herring existential and moral claims, which fish blindly for anything that they can hook their offal into. In this category, I'd include when Tennessee's SB1 states it desires only to encourage minors to, quote, appreciate their sex, wanting to protect their ability to later, quote, create children of their own. That language was echoed by Federal Deputy Health Secretary Jim O'Neill when he said the new HHS policies are needed to assure young persons live, quote, life as it was meant to be lived. No mention in all this about how life-saving gender-affirming care has repeatedly been proven to be. The bitter irony, of course, is that to appreciate ourselves as ourselves is exactly what any trans and gender-diverse person seeks to do, youth or adult. To get to a place where a home, a family, a life of our own seems possible is something we ourselves want to nourish and protect. However, all of that only matters when one can imagine a path forward. Not to put too fine a point on it, but living is how life is meant to be lived. Sadly, there's no surprise that this simple and essential point would be overlooked. And as before, Tennessee's SB1 serves as the launch point, belittling and dismissing our existence from the get. Repeatedly, it waves off the realness of trans and gender diverse persons by talking about our purported, our asserted identities. Then to add insult to insult, injury to injury, the legislation goes on to label what we feel as only so much, quote, purported discomfort and distress. Such cavalier disregard for another's experience directly contradicts both Tennessee's and the Fed's stated need to, quote, protect the health and welfare of minors. After all, if one can't acknowledge someone's pain, how can they be trusted to protect anyone else? All pain is purported. This is the reality, only available to others through the ways that it is communicated by the person experiencing it. Their self-purport, as it were, is all we've got. Our self-report is all anyone else has got. And so if we really want to take action to protect the health and welfare of anyone, the most important thing we can do is listen to them and believe what they tell us, both when they're hurt and when they're happy. The reality of their lives and experience, our opportunities to develop into persons of fullest flourishing, deserves nothing less.